Hi, my name is Laura and I am one of the lymphedema nurses here at St Margaret's. Welcome to our video, which is to support people who are at risk of developing lymphedema after treatment for cancer. Patients are considered to be at a higher risk within the first 1 to 2 years, although the risk remains lifelong. In this video, we will look at the lymphatic system and give you helpful hints on how to reduce these risks. So who are we? We are a team of dedicated nurses with a range of experience and knowledge specialising in lymphedema. Our clinics run from Monday to Friday from various sites across Somerset, but mainly from our Taunton and Yeovil Hospice sites. So what is lymphedema? It is a long-term chronic condition that causes swelling in the body's tissues. It can affect any part of the body, but usually it develops in the arms or legs. But it can develop anywhere the lymphatic system does not work properly. On the next few slides, I will explain what the lymphatic system is. The lymphatic system helps our bodies get rid of toxins, waste, and other unwanted materials, including infections and cancer cells. It is a system of thin tubes called lymph vessels and lymph nodes. These run throughout the body. The spleen, thymus, adenoids, and tonsils are all part of the lymphatic system. Along the lymph vessels are small bean-shaped lymph glands. You might be able to feel these in your neck, under your arm, and in your groin. But they are also throughout the body, including the chest, abdomen, and pelvis. The lymphatic system carries a colourless liquid called lymph as the blood circulates around the body. Fluid passes from the blood into the body tissues, carrying food to the cells. This fluid bathes the tissues to form tissue fluid, which collects waste products, bacteria, damaged cells, and cancer cells if there are any. The fluid then drains back into the lymph vessels, where it is transported towards the lymph glands. The glands then filter the lymph, taking out any harmful products. The lymph also contains lots of white blood cells, which helps us fight infections. The lymph eventually reaches a large vessel at the base of the neck, called the thoracic duct, which passes the filtered lymph back into the blood circulation. If the lymph vessels or nodes are blocked, removed, or damaged, it causes a buildup of fluid. This can cause swelling, known as lymphedema.
There are many causes for lymphedema. These include surgery, particularly when lymph nodes are removed during treatment for cancer, such as breast, prostate, gynecological, head or neck. Radiotherapy. This kills cancer and tumour cells, but it can also cause scar tissue that interrupts the normal flow of lymph in the lymphatic system. Accidental trauma, injury or infection. This may damage the lymph vessels and therefore reduce drainage of lymph. Reduced mobility, paralysis. Muscle contractions, which happens during movement and exercise, are important to help the lymph to move. Problems with veins not working efficiently, like varicose veins, or after deep vein thrombosis. This results in the lymphatic system becoming overloaded and unable to function effectively. Obesity. This can also cause lymphedema or exacerbate the problem. Cancer itself may also result in a blockage of the lymphatic system. Some swelling after your surgery is perfectly normal, particularly around the site of your scars. This is part of the healing process and usually settles down around 6 weeks after your operation. However, if your swelling does not go down or resolves and then comes back, you may have lymphedema. Other early signs and symptoms that people have experienced include your clothing, shoes or jewellery may feel tighter than usual. You may experience heaviness, stiffness, tightness, or a feeling of fullness in your limbs. Your limb may ache more than normal. The normal shape of the limb may not be so noticeable. For example, you may not be able to see the tendons or knuckles in your hand, or your ankle bone may look less prominent. Swelling may be intermittent, may be more noticeable at the end of the day, and then reducing overnight with elevation. So, what can you do to reduce the risks of developing lymphedema? In the next few slides, I will give you some helpful tips on what to try and avoid and how you can help yourself. However, as we do not know why some people go on to develop lymphedema and others do not, please remember that while it is sensible to do all you can to try and reduce the risks, it is equally important to live your life in the fullest way possible and not to feel guilty that you have caused the swelling if it should develop. Avoid having your blood pressure taken, as the tightening of the cuff can cause congestion. Blood samples or acupuncture on the affected side can increase the risk of infection due to a breakage in the skin. Try to avoid repetitive movements like gardening or knitting, and if this can't be avoided, make sure to have rests. Avoid heavy lifting or carrying. Gaining weight and being overweight is one of the biggest risk factors in developing lymphedema. In order to reduce that risk, it is important to maintain a good healthy diet, exercise regularly, and do all you can to keep your weight within normal limits. Gentle movement, exercise, and activities will help the muscle pump lymph fluid throughout your body. This could also help to improve and maintain flexibility and keep your bones strong. It can also help you achieve and maintain a healthy weight and may well improve your emotional well-being. Any movement that stimulates the muscles is beneficial. Try to do a little every day and build up gradually. Remember to pace yourself and listen to your body. Activities such as walking, swimming, cycling, gardening, yoga, and Pilates can all be helpful. If you notice any activity cause increased aching, swelling, or feeling of heaviness in your limbs, either immediately after or in the days following the activity, reduce the intensity or try some other form of movement. Check regularly for fungal infections and be proactive in dealing with any infections. Avoid tight-fitting items, as these, like the blood pressure cuff, can cause congestion. Wear a good-fitting bra, like a sports bra, as this will support the tissues and improve flow in the vessels. Skincare is also very important, so please protect your skin to prevent any breaks. Using moisturizer daily will keep the skin soft and supple. You could wear gloves for gardening. Use sunblock. This is especially important after radiotherapy as the skin is more vulnerable. Use insect repellent to prevent bites. Treat cuts, grazes and burns promptly. You could consider wearing compression for long-haul flights. Signs and symptoms of cellulitis include increased swelling, increased heat, increased redness, possibly tracking, general flu-like symptoms like feeling unwell. Be aware, early recognition is vital, so watch out for any unusual swelling or change in sensation like aching. Cellulitis needs to be dealt with promptly, so please seek medical help from your GP or out-of-hours services. What will happen when you come in? Hopefully you have had an LDEX scan before your surgery, but please don't worry if you didn't. The scanner sends low-level waves through your body and gives us a reading to show if there is any fluid present in the at-risk limb. It can detect the smallest amount, which helps us to be as proactive as soon as possible. We will also do visual inspection of the skin and feel the tissues. Follow-up will be every 3 months or sooner if we think an earlier appointment is needed to keep a closer eye on things. The sooner lymphedema is spotted and managed, the better the outcome.
We hope you have found this video useful, and if you have any concerns, please do contact the service. Thank you.